Are you a cash PT stressing about patients being inconsistent during the holidays and your schedule falling apart because of it? You're not alone. The holiday season is when many clinics face a surge in cancellations and patient drop-offs, but it doesn't have to be that way. With the right approach, you can manage your schedule effectively, keep your patients consistent, and ensure they don't lose progress over the holidays. In this training, I'm going to give you the exact playbook and script that my team uses to ensure schedules stay full and patients remain consistent through the holidays. Let's dive in. All right, guys, when it comes to optimizing your schedule and decreasing reschedules and cancellations during the holiday season, it all comes back to communication and setting expectations. So this playbook is word for word the exact copy that my team uses to guide their conversations and setting expectations with patients to decrease reschedules and cancellations during the holiday season. In fact, we actually have a lower cancellation reschedule rate even during the holidays than industry standard. So this playbook, feel free to use it word for word, recreate it however you see fit. They'll go through exactly what we do within my practice during the holidays to make sure that we keep the schedules full. So really the objective is to encourage clients to schedule appointments through the holiday season to prevent loss of progress and avoid scheduling difficulties. So it's much easier to address issues upstream and set expectations than trying to deal with the repercussions of it downstream when they're already saying that they can't schedule or that they're already canceling and rescheduling and you're trying to win them back. It's much harder when it gets to that stage, so we want to make sure that we prevent it from the beginning. So we really want to emphasize the importance of consistency and scheduling during the holidays. What we do is starting around like November, or the first week or second week of November, we start having these conversations with patients. What we want to do is we want to make sure that patients are scheduled out and they have their appointments scheduled out throughout the remainder of the year and ideally into early January so we can get through the holiday season so they already have things on the books. This is our exact word-for-word scripted communication. We state, hey, Ms. Smith, with holiday season coming up in the past years, we've noticed that some patients struggle to stay consistent, which can lead to a loss of progress and essentially starting over in the new year. And I don't want that to be the case for you. My schedule also fills up pretty quickly around this time of the year because I'm also taking a holiday time off. So my availability, my schedule is less. With that being said, let's go ahead and get your sessions scheduled out through the holiday season so you can get the times that work best for you before my schedule fills up. I currently have X, Y, and Z times available. Which of those work best for you? So what we're doing is a couple things here. We're adding urgency and scarcity. So urgency, we're placing urgency because we're already stating that, and this is the case, my team takes a time off during the holidays. And so their availability in their schedule is less because of it. And so by allowing patients to schedule in early November, early to mid-November, they can get the times that work best for them. And that's the thing too that we place in here is patients want to know what's in it for them by actually scheduling these out. People want convenience. They want to be able to attend sessions that for times that is convenient for them. They don't want to have to try and come in during times that are not convenient for them. By giving them that option and encouraging them to schedule for times now that are most convenient for them, it encourages them to do that and they have incentive to do so. That's the thing too, is we also aren't really asking them. That's the thing too, is you don't want to position it as like an ask. Like with that right at the end, hey, let's go ahead and with that being said, let's go ahead and get your sessions scheduled out through the holiday season so you get the times that work best for you before my schedule fills up. I currently have X, Y, and Z times available. Which of these work best for you? We're not asking if they want to do it. We're asking which times work best. And then we get them scheduled out through the entire holiday season. Some of you guys might be thinking, well, and we get this too, you're also a lot of times going to get some objections that you have to overcome. A lot of times people will be fine with this and get scheduled, but there's going to be some people, the most common objection that we get is I want to hold off on scheduling because I don't know what my holiday schedule looks like. Okay, or there's uncertainty around that, which is fair. Like that's the thing too, is like my schedule, there's a lot of uncertainty with my holiday schedule too. So it's expected that patients are going to have the same thing. Objective is we practically want to handle common objections about uncertain holiday schedules to encourage clients to pre-book. Still want to try and overcome this. What we want to do is, so again, objection, I'm not sure what my schedule looked like with the holidays. Response, hey, totally understand, acknowledge that. And then also try and relate back to them too. Be like, hey, totally understand, my personal schedule is also unpredictable this time of year, so I get it. Even if it's just a guess, let's schedule something so you have a spot reserved. If it doesn't work, just let us know 24 hours in advance and we'll adjust. You just need to let us know 24 hours in advance and you're good to go. There's no cancellation fee if it's outside of 24 hours. It's much easier to get off the schedule than it is to get back on during the holidays, especially because, like I said, my schedule fills up really quickly. With that in mind, I currently have X, Y, and Z times available. Which work best for you, right? We're not asking them. We are repitching. You need to make a re-offer right after you're done with that. So with that in mind, I currently have X, Y, and Z times available. Which work best for you. That's how to go about overcoming that objection. We tell them, like, even if it's just a shot in the dark and you don't even know if it's gonna work, let's just get something on the books so you have it if you need it. Again, these strategies are going to help immensely. It's not going to win everybody. It's not 100% foolproof. However, it is substantially going to decrease your cancellations and reschedules throughout the holiday season just by doing this. Super simple. It just comes back to having conversations early and often about this and setting expectations and letting them know that, like I said, you can also tell stories of past patients that didn't pre-book and it came into January and they missed 4 out of the 6 weeks, the remainder of the year, and they were pretty much starting from scratch into the new year, and you don't want them to have to start all over again, okay, because of it. All right, so tell stories as well if you continue to get, somebody gives you multiple objections. So again, key points to reinforce: availability. Emphasize your schedule fills up quickly during the holiday season. Flexibility. Reassure clients that they can reschedule within a 24-hour notice if their plans change. You do want to reemphasize, I don't know what your guys' cancellation policy is, but ours is a 24-hour policy. They need to know, they must let us know greater than 24 hours if they need to reschedule. So we do remind them about that, but let them know that they are clear to do so outside of that 24-hour notice. And then again, consistency and care. Reinforce that maintaining a regular schedule helps prevent setbacks and keeps them on track with their goals. Summary. By following this end of session script, clinicians and staff can proactively reduce holiday cancellations, secure consistent bookings for clients, and help clients stay committed to their treatment plans throughout the holiday season. It's this simple, guys. It really just comes down what I see the biggest issue that most people have with this is they are trying to address objections down the road when it gets closer and closer to the holiday season. By having conversations early and often starting in the first or second week of November, it makes this conversation so much easier and your schedule is going to stay much more consistently full throughout the holiday season. If you guys want this exact playbook and resource, click the link below and you can retrieve it there. Thanks, guys.